Hi, welcome to Fertility Talks. I'm Mary Wong, your host, and this is live post number 103. Today, we are going to be talking to one of my favorite acupuncturists, Doctor of Traditional Chinese Medicine, who is in Vancouver as we speak. He is the founder of AcuBalance Wellness Center in Vancouver, and he's also the founder of Healthy Seminars and the Integrative Fertility Symposium for Acupuncturists and Naturopathic Doctors. He received his Doctor of Traditional Chinese Medicine at the International College of Traditional Chinese Medicine with a postgrad training in clinical hypnosis, infertility, cold laser therapy, which is what we're going to be talking about tonight. So I'm so thrilled to have you here. And you also do functional medicine. So you're legally allowed to do functional medicine in Vancouver?
Well, I'm trained in it, but I have a functional medicine specialist. So when I see patients, we will send them into our functional medicine naturopathic physician.
Yes.
But I did all the training, so I'm aware of the test order and what's going on, so I can have that dialogue in the clinic room. But as you know, I've done training in lots of things, and then I share with the people I want to do it. For example, I'm trained as a clinical hypnotherapist, but when it's just hypnotherapy, I send them to a hypnotherapist. If they want the acupuncture with the hypnosis, I can do that together. But if it's straight hypnosis, I refer off. I'm a kinesthetic learner. So rather than just reading, I like to actually get degrees and designations in something so I understand it. Yes. And then I either implement it somehow in my practice, or now I can refer out. Patients seem to really gravitate to that because you can just read about it. I actually trained in it and can practice in it.
Yeah, and I'm similar like yourself, and I also love to experience it all as well. And so, you have something to say about the actual experience when people ask. And yeah, like you, because you and I both wear a hell of a lot of hats, so it's easier, and we don't have time to do everything, right? So, and I know you're always jet setting. It's really cool to see you. So for those who do not know Lorne Brown, he is, I would call, a rock star in our field, and he's literally going around the world and teaching and informing, educating other practitioners. And I love that you really are the pioneer who has helped other acupuncturists really get into our field more. And you've brought it to the next level because of online. Like, hello, it's awesome. Thank you.
Yeah, thanks. It's been fun and challenging to pioneer stuff. We've done that we brought IVF acupuncture on site. We started that back in 2002. We were the first clinic to do that when they were throwing us out, but we persevered and we got that going in Vancouver, the online learning for Chinese medicine, naturopathy, and then the integrated fertility symposium. And now the laser, right? So the hard part of that is, the great part is you get invited because you're the pioneer and you're there's some cutting edge stuff. The hard part is you don't have anybody to help you as much, right? It's nice to have somebody who's already carved the pathway. So I'm always looking for colleagues that I can brainstorm with and learn from as well. So it's been great. It's been a great experience for me so far, doing some of these things that are a little outside the box, a little uncomfortable, but worth it in the end.
Yeah, and I love it that you're saying that, because for years I had a patient that was he was invested in a laser company. He kept on asking me to go. I'm like, I'm a traditional person, la 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 la. And in the end, he pulled me in, and I was floored at the impact. And I'm not sure if that's how you got into it yourself, but that personal experience and going into the company and seeing the actual impact. So without further ado, let's talk about laser therapy. Now, back in my post number 91, I interviewed Arnie Grinstead, who is a founder of a laser company. So it's like low-level laser. We talked a bit about that, but I wanted to bring in an actual practitioner who does it all the time. So we do it at our clinic, but I will not profess to say that we do it all the time. So what percentage of your patients do laser, if you don't mind me asking?
Ooh, it's a high percentage because we integrate it pretty well. So a lot of our patients are getting acupuncture with laser. That's a small percentage that just get the laser, but we're using the laser in our practice for fertility. That's kind of where we're pioneered in North America. We use it a lot for pain. If I had a choice between the needle or the laser, I often would choose the laser. Together, much more effective, obviously. And then we've experimented a bit with Alzheimer's. I say experimented because we've only had a few patients with that. And there was a study out of Harvard, and I was able to dialogue with some of the investigators at Harvard. So look at the protocol and then program my lasers. So we've done that, some concussion, post-concussion syndromes. And now for people with anxiety and stress, we're playing with the laser, playing with the frequency at 10 hertz to put into what's called alpha wave. So we play with it, but for the most part, I would say over 50% of our patient population is getting laser with their acupuncture treatments.
That's awesome. Yeah. So we're definitely not at that level, but like you, when we do acupuncture, when we do laser, it's typically with and in conjunction to the acupuncture session. Now, so being that you have such a high percentage, now do some of these people start out just as laser patients because, fear, let's say needle phobia? Or
yeah,
not
well,
that?
what happened when we brought the laser in? So I'll give a little background. The laser for me started in around 2008. There was an abstract that was to be published, and I got a chance to learn about it before it was actually even published, the abstract. And it was called Using Laser Acupuncture in an IVF Setting. So there was an IVF protocol, as you know, the Polish protocol for day 3 transfers. And this study showed that the laser had a 15% increase in implantation over sham laser. So it showed it wasn't benign. It was actually a laser with a sham laser over a control group as well, even over just the regular acupuncture group. So I, after reading this, or not reading it, hearing about it from one of the lead investigators, then it was published. I contacted the REI, the IVF doctor. I contacted one of the acupuncturists involved in the study, and we bought the laser and used their protocol on site for IVF. So we started doing that because honestly, it wasn't a small investment. Those lasers aren't cheap. Anything that's going to improve the chances of our patients, we're willing to invest in that doesn't have any risk or side effects. So that's how I got introduced to the laser. And then for a couple of years, I was like, geez, I really would love to be doing more with this laser, because as I learned about the mechanism, one of the mechanisms of laser therapy that really excites me is that it can improve what's called the mitochondria function of producing ATP. So it improves the energy production on a cellular level. And since we know the science today says older women, one of the concerns is the mitochondria function, the energy production of the oocyte, the egg, which gets passed into the embryo. If there's a decline in that, then there's less chance of embryo dividing and implantation. Why? Because it requires a lot of energy for the embryo to keep dividing and to implant before the placenta is formed. And so we tell patients to take coenzyme Q10. We tell patients to take antioxidants to reduce free radical damage, which is not good for the mitochondria. So I was like, wow, if we could get some light to the ovaries, these photons, which has been shown to improve the mitochondria function on a cellular level. We've seen this in wound healing. We've seen this in injuries and pain. Then, geez, theoretically, we could rejuvenate the egg cells. And so that's when I really started digging into the research. And it was a few years back where I found some studies out of Japan, the clinic, Dr. Ashiro's clinic, where they were using the laser in an IVF setting. Now, it's really, I got to share this story because I think you and your listeners will appreciate this. It was quite interesting how Dr. Ashiro came across this for fertility. So he's a medical doctor and he treats pain. And what was happening is he had a woman that was around 55, menopausal, that came in with back pain. And so he treated her for back pain. And her back pain was resolved, but she started menstruating again, which she was not happy about. And she'd bleed for 4 to 5 days, and then 3 to 4 weeks later, she'd bleed again. And so he just thought, interesting. But within a year, another woman, back pain he treated, right? And she started menstruating again, a woman that was in menopause. So he talked to one of his colleagues in the hospital, and he said, well, let's do a study. So they did a small study of about 74 women. And these were poor candidates. It translates into English as severe infertility. So they had like over 9 years of infertility, many years of ART, so Clomid or IVF, lots of failed cycles, average age 39. And this small group of women that they did the laser therapy leading up to their IVF transfer, they had about a 22% increase, 22% pregnancy rate and a 50% live birth rate. And these are women that really, they're donor egg candidates. But in Japan, they don't do donor eggs, right? So this is why they were doing anything they can to improve their egg quality. So then they expanded that study from 74 to 701, so a much bigger group, and they still got the 22% pregnancy rate with a 50% live birth rate.
So just out of curiosity, hang on, I want to cut you in.
So that's when I got into the laser therapy, more than just doing an IVF. We said, okay, let's start doing this in the preconception phase for our patients. Go ahead.
Right.
What was your question?
So the actual question then becomes, so in the preconception phase, are we doing it full 3 months prior? Are you doing once a week, twice a week, 5 times a week?
So what we do and why we do it. So the Japanese study mostly did what's called a peripheral protocol. They did lasering over the carotid, right? And then the stellate ganglion. So, basically just in front of C7, but you can get to it through here. Kind of our stomach 12 idea in that area.
Okay, so so this is for viewers that don't know nothing about this. So tell us where it is.
So I'm not going to go into detail because if you don't know what you're doing, you shouldn't be doing it anyhow. So
no. Meaning telling the lay people they're not doing it. They're just saying, it's by the neck, right?
Yeah. So the Japanese study did the neck. Why? They showed that when they did the carotid, it engaged the parasympathetic nervous system, your relaxation and response system. And they did thermophotography, and they could see that the blood flow from head to toe improved. So they wanted to keep that master brain full of blood, and they wanted blood flow everywhere. And that's what the Japanese study, the Oshiro study group, they believe the reason it was improving was because of the massive blood flow. Now, I don't think that's the main reason, because we do that great with acupuncture. But that was their protocol, as they noticed when they did the carotid approach that they saw blood flow everywhere. And they saw their results of 22% increase in pregnancy rate and 50% live birth rate. Then the Denmark group, which wasn't a study, Arnie, that you interviewed from Power Medics, and I talked to the Anne-Marie Denson.
Back off. You cut out for a second. Repeat that part after Arnie.
So then Arnie, he published an article where he talked to his practitioners in Denmark using the laser for fertility. And one had a large caseload. Now, this isn't a study. It's just people reporting their data. And she had a large caseload. So I started talking to her via email. We had a conversation. She wrote a book. I got to read her English version, write the preface to it. What they did is they did people 3 times a week in the follicular to get 6 visits. So what do we do at AcuBalance? We do 3 times a week. Ideally, this is what we want, and it's preconception. Why? Chinese medicine says, nourish the soil before you plant the seed. The follicles, which contain the egg, go through a recruitment process. It's about a 1-year process, but the last 3 to 4 months is when a lot of things happen. If that environment's good blood flow, your nutrients are at the right level, you don't have endocrine disruptors or chemicals interfering with your egg quality, those free radical damages, that rust that the body can have, then and the mitochondria is being nourished, then there's a better chance to reach your peak fertility potential. So for 3 months, we like to see you 3 times a week in the follicular, so that works out to 6 visits before ovulation. And then in the luteal phase, we see you 1 or 2 times a week doing acupuncture. And we still do laser, but we do it on the sternum or the tibia because of it's shown to help with stem cell proliferation, right? So we're enhancing the immune system, trying to rejuvenate the body on the full level. So our protocol is neck and lower abdomen over the ovaries during follicular. And then we don't do it over the lower abdomen in the luteal phase because we don't want to put light over a developing fetus. Now, there is no real concern of damaging the baby. It's light therapy, but logistically, nobody wants to do it because, God forbid, if you're one of those people that has an issue, because some people, they have children born with defects or there's miscarriages, we go to the fact that it must have been that. So right now, because nobody studied it, nobody is putting light over the abdomen. You can still treat a woman with laser therapy in pregnancy. You just don't put it over a developing fetus, right? So
So are
that's kind of
you
what
doing
we're
that
doing.
then? Are you treating people with laser during pregnancy?
Sure, somebody comes in with shoulder pain, carpal tunnel syndrome,
Yeah,
we treat it. Somebody had sacral pain, we use acupuncture, moxa, cupping. We don't use laser, right?
right.
We won't
Yeah,
put laser over the sacrum or the lower abdomen if we know there's a pregnancy.
right. And of course, this, goes really the same for acupuncture. And
Yeah,
so
yeah.
we also find great results with endometriosis. Are you using it for endometriosis pain?
Yeah, so Dr. Fred Kahn out of Toronto, he's kind of the brains and creator behind the Bioflex laser. In the book, The Brain's Way of Healing by Norman Deutsch, this is how I discovered Bioflex as one of the lasers to use. He talks about his anecdotal experience. Dr. Fred Kahn used to be a vascular surgeon, and he talks about using the laser for endometriosis patients and seeing results where they're able to cancel surgery. So we use it for PCOS, we use it for endometriosis, menstrual pain, and fertility. I want to talk about, we use it for men as well. But
Yeah.
one thing I want to share is what we've done in our practice, just to people ask, like, what kind of results you're seeing. The fertility clinic locally that we treat on site for IVF, we use a laser protocol. We have a protocol that we've come up with because most of them are day 5 transfers now. So we don't
That's right.
use the protocol that we use in day 3. And the clinic was saying, sometimes studies say it works, sometimes studies say the acupuncture doesn't work. So they asked us, because a study came out showing not beneficial. And I clarified with them, first of all, the research should have said, this acupuncture protocol, these specific points done at this dosage, is or is not effective. And so we have a different protocol than the recent one that was studied. And dosaging matters. So that study had, I think, only 3 visits. Olive did an audit. It was just, it's not like, it wasn't a study. It was retrospective. We looked backwards because they wanted to know, are we helping patients? So what they did, it was really interesting. They only looked at frozen embryo transfers of genetically chromosomally comprehensive chromosomally screened embryos, meaning they looked at embryos that were transferred that were known to be normal. This is really interesting because when you do all these studies, and if you have chromosomally abnormal, if you have an abnormal chromosomally embryo, then the chances are it won't implant or it's going to miscarry. And so they said, we want to know if the acupuncture and the laser is improving implantation rates. So let's look at the AccuBalance patients in the last 2 years. So it was from January 2018 to March 2018, so just over 2 years. Let's compare our patients that had frozen embryo transfers on, that were day 5 transfers of normal, chromosomally normal embryos, and compare to those of the AccuBalance patients. And what we saw was that the AccuBalance patients, using the protocol that we do with the laser and acupuncture, had a higher pregnancy rate and a lower miscarriage rate than the patients that didn't have it. So there's our first chance of saying, hey, this is doing something. Then we looked at dosage, and people, you mentioned preconception, people that had 7 or more visits leading up to the transfer, where they were using acupuncture to increase blood flow at that time, to promote blood flow to the lining, they had the highest pregnancy rate, lowest miscarriage rate.
Absolutely.
So
I love it that
now,
you have it documented. It's great.
yeah, so they just looked at it. Is it helping? And so now we've sent in a proposal. It's going through ethics to do a study on that again, like a real official study where we can have a bigger population and clean it up a little bit better. Because that was it's observational studies, what you call that, right? It's not like high end study, but it's nice that most people are saying our treatments work because they're quoting it works in other. We've seen it in research, but nobody's auditing their clinic. This was nice that they had a look to see, is this helping or is this hindering? And it was nice to see that we saw a trend towards increased pregnancy rate, lower miscarriage rate for that. We're hoping to do more research. We're in the works for the protocol we're doing to see how this is improving those that are doing fresh cycles, right? Because that's where I think the power of our medicine is. When you look at an IVF study, it's only looking really at, are we helping with uterine receptivity? Why? Because the embryo is in the lab now. But if we can treat people for 3 months before, this is where hopefully we can help them reach their peak fertility potential and therefore improve or optimize their egg quality, sperm quality, therefore take-home baby and a healthy baby.
Yeah.
We're also doing, it's been done on men too. That's the easiest one to study. So There are lots of animal studies showing it improves motility. Why? It's that mitochondria again. It's improving the mitochondria, so the battery of the cell. And we have done with some patients' consent where they weren't using it, the fertility patients, but they weren't using the sample that they were giving at the lab for a fertility procedure. They were just getting their semen tested. We would go in and we lasered their sperm. And so there was looking at the sperm, looking at their motility, and then lasering sperm after about 30 minutes or 20 minutes, and then looking at the two sperms together again, and the laser showed an increase in motility. The research has documented this. I just wanted to see it for ourselves. Could it do that? And so there are some protocols using a laser on the testicles. And again, before you jump and do this, heat's not good for sperm. So if you're using like arrays, like the LEDs, I'm not clear if that will be beneficial. Theoretically, it improves testosterone production. It should improve motility, but I don't know how hot your LED lights get. And so it may actually hurt motility and count. We use a laser, class 3B, so under 500 milliwatts or less. So that's non-heating. Right. And the laser's always moving and it's not really touching the testes. So, if you held it in one place for a long period of time, that may not be great for the sperm. And same thing for the eggs. You want to know what kind of laser. Some people have class 4s and strong lasers, and I don't know if that would be good for the eggs. So the research I've seen so far in animals and in the humans, they're all using the class 3B, 500 milliwatts and less. And the science is there. The evidence isn't there yet. So the science, people say, so how does it work? Why will it help? So I'd like to share the mechanisms with you and the audience. So one is it increases blood flow. More blood going to the ovaries, more blood going to the line. This is really great because the blood's going to bring nutrients, it brings oxygen, it brings the hormones, all the things to be conducive to help the egg reach its peak fertility potential and the sperm. Acupuncture does that wonderfully as well, by the way, but laser as well, as we mentioned in the carotid protocol, and just putting it locally. 2 is it regulates inflammation. I think this is why so many people, why you'll see laser therapy can treat so many diseases, because inflammation, also known as inflammaging, can lead to accelerated biological aging and therefore degenerative diseases. And I had premature fertility decline. And so if laser therapy can help regulate inflammation, and it's been shown to overall reduce oxidative stress, this is all the stuff that's causing damage to our cells, then obviously you're creating an environment for the cell to thrive, right? There's so many diseases that are a result of chronic systemic inflammation. And then the third reason why the laser is so beneficial, and this is why I think it's the game changer, is the photons, when it reaches a cell, increases mitochondrial function, the ATP production. This is the battery of your cells. So it's basically recharging the cells. So this is where we see in wound healing and pain and injury, why does it work so well? Why can it help repair tears? Or why does the wounds, cuts, and diabetic ulcers heal quicker with laser? Is we're rejuvenating the cell so it can start to divide and do its own repairing. That's the whole idea of Chinese medicine, is the body has this innate ability to heal. And if the body has the ability to self-regulate, when it falls out of balance, it can come back to that homeostasis. It can self-regulate. That's the innate ability to heal. But if the mitochondria are old or damaged, then you don't have that repair mechanism. And the laser improves that repair mechanism because it gives the cell the energy to start to divide again. And this is why I said earlier, why are patients taking coenzyme Q10? Why are they recommending antioxidants like, acai berry and melatonin and take all the antioxidants? It's trying to protect the body, the cells, from free radical damage, oxidative stress, which I like to call body rest. The sperm also, same thing.
That's funny. Really I call it that too. I call it that too. Yeah. So that's the mechanisms. It's enhances mitochondrial activity, therefore ATP production, increases blood flow. It can regulate inflammation and reduce oxidative stress, and it can soften some scar tissue. So that's the beauty of putting it on, those abdomens where people have scarring stuff and endometriosis. So I think it's quite an exciting tool that doesn't have side effects at this stage. When we look at it, the only thing that we contraindicate, if somebody's bleeding somewhere, you don't put it because it increases blood flow. You wouldn't put it over
a bleeding ulcer or somebody's menstruating and they're having heavy flow right then and there wouldn't be beneficial. Outside of that's okay.
And how about cancerous tumors?
You know, they are using laser, cold laser, and the wavelength depends to treat cancer, especially in Europe.
That's right.
But right now, they say don't put it over a cancer. It won't cause cancer. They're using it to treat cancer.
That's right.
And there are studies on that. That's what kept me a couple years from using it for fertility patients was, geez, with the laser, if it improves cellular division, if somebody had dormant or had ovarian cancer tissue, would I accelerate that? So that's what kept me from doing it for many years over the ovaries until I looked at all the data and how it does not cause cancer and actually use it for treating cancer in some cases. But right now, when you look at the world regulation and associations on laser, for the most part, they say don't put it over a malignant tissue. So if you know there's a cancer, don't put it over there. And again, it's more probably cover your ass than anything else. But there are, in Germany, where the people doing the laser therapy are medical doctors, they're using it in cancer treatments. But again,
in Toronto, there's an ongoing study cancer. Yeah.
But it depends on power is important and wavelength. So certain wavelengths, too much power, that can lead to cancer. Like there's certain wavelengths. So when we're using red and infrared, so those are safe wavelengths. When you start to get into the ultraviolet light type of wavelengths, then those are the ones that are high powered, this powerful weight, more energy is packed in, and those are the ones that can damage tissue. And then if the power of the laser is strong, there's some heat in the tissue. If the power of the laser is over 500 milliwatts, then that also can lead to heating of the tissue and possibly damage. So the literature is on low level, most of the research is on low level laser therapy. That's at 500 milliwatts and lower, and that's on the wavelengths in the 600 to 900 wavelengths. For mitochondria, interesting enough, the 700 wavelengths don't seem to be as beneficial for the mitochondria. So the red, which is in the 600 ranges, are good, and then in the 800s. And again, why I love doing the deep dive, the higher the wavelength, the deeper it can go. So we're like, oh, let's go higher, like high 900s or 1,000 to reach the ovaries maybe easier. But those wavelengths, water absorbs the light. So now we're going to have all the water absorbance. We're not going to get to our target tissue. So it's this happy medium of how much power, how long to hold it, what's the right wavelength. And this is what I've been spending the last couple of years talking to experts around the world, reading the literature, trying to figure out what the right wavelength is and how many joules you want to put into the area. So I will share with you, I think the science is there saying this is something that can be great for fertility. The science is there. The evidence isn't there yet, but that's always the case. The theory's there, the science, and then we prove it later. Einstein knew relativity. The theory was there before he could prove it. Luckily, we have the Japan group that did some research, so they've shown some evidence there. There's some animal studies where they've shown improvement in embryo quality and like birth rates in the animal kingdom, and now we're working to do some research here more with our patients. And again, it's a tool that I've really enjoyed adding to our practice because you don't feel it. Our patients who had needle phobia, they come in.
Exactly. So I was going to stop you and say, okay, we talked so much about this, and I want all of you to know that this does not hurt. And, you call it LLT, I call it low level cold laser. So meaning that when you have like high wavelength laser, that is hot and it's cutting. So, you hear about laser surgery. So don't visualize that.
It's actually the power. It's not actually the wavelength. So the wavelength, the higher numbers are just the energy packed in the it's going to show the depth and how many I'm thinking frequency here. When you look at your wavelength here, the heating principle is more the power. So it's going to be those 500 milliwatts plus. When you start to get to 1 watt or 2 watts or 3 watts, that's the heating power. The wavelength is a little different than that.
Yeah, but that's my point in terms of, you don't want, like you think about a cutting laser, right? Which is very, very different than a low level cold laser.
And so the LLT, so if people want to go, how do I search this? So the actual current term that they're using in the science community is photobiomodulation. So if you want to know, like, photobiomodulation plus concussion, photobiomodulation plus herniated disc, then some of the research will come up. But most of the research, that's the term they've agreed upon as of early 2018. Before that, it was LLT. It's not low-level cold laser. The reason they nicknamed it cold laser is it's non-heating. It's not cold. It's just non-heating.
Yeah.
But LLT stands for low-level laser therapy. Some people call it now low-level light therapy because they're using laser and LED, so coherent and incoherent light. So often, if you Google LLT plus the condition, then you'll start to see the research behind laser. If you do cold laser plus, you're just going to get people's websites. But if you do LLT or photobiomodulation plus the condition you're thinking about for yourself, then usually the research will show up. And I will add, dosage matters, power matters. So in the literature review and talking to the people that are experts, I'm talking people that have been doing this for years, I'm really in the trenches. When you look at the research, sometimes you say it doesn't look like it helped. And what I've learned is dosage matters. So once a week laser at the beginning, it's not going to benefit you very much. It's really not going to be enough. So usually what we do is 3 times a week, we start our patients for the first 2 weeks, whatever we're treating, to get on top of the condition, to help the body, to kickstart the body, right? And then then you can cut back. So often the studies, if they're once a week or every other week, it's just not going to benefit enough, right? You're not getting enough blood to the source often enough. The other thing is the power of the laser may not be correct. So somebody can say, I have a laser, and say the laser is 5 milliwatts. Well, 5 milliwatts, and you're holding it over the point for 10 seconds, you're not going to get enough energy, enough joules into that area to have an effect on the tissue. And so it's called Arndt-Schultz law. Not enough light, no response, and too much joules, you can disinhibit the response. So there's a sweet spot, and the sweet spot's really generous. But a lot of studies, or people using a laser would say, I tried, it didn't work. They either didn't do the right dosage as how often they see their patients, or their laser's too weak. So you'd have to sit there for a half an hour on each area to do anything, and nobody does that. So you do need the right power, and you need to see them enough. We know this for acupuncture. Somebody's coming in with an injury and they start off every 2 weeks off the bat. You're not going to see those results for the injury. But if they come in 2 or 3 times that week, you're going to see a difference, even though the same protocol you're using.
I have a question from a viewer here. It says, Susie, thank you for asking this question. Would this laser help with cell donor eggs for implantation? That's actually not clear to me what you're asking.
Would it help with if you're doing a donor egg? Well, there's 2 ways to answer this. If you're doing a donor egg, we're going to assume that the donor is young and healthy. So no extra treatment necessary for her. And is it going to help with my uterine receptivity? It will help with uterine receptivity. That's what we saw in 2 studies. One was done where I mentioned the RMA group did a study back in 2008. That was an abstract. It got published in 2018, where it showed a 15% increase in implantation, where they had a laser group, a sham laser group, an acupuncture control. And then we did just an audit where we looked at our patients where we did acupuncture and laser, and the trend was increase in pregnancy rate and lower miscarriage rate. So yes, it would help with uterine receptivity. Now there's one study that came out this year on uterine receptivity.
Hang on. She's asking about the donor egg. So I'm just wondering, okay, Susie, do you mean like donor egg banking? Is that what you're talking about? Because I don't think we can access that anyway.
So there's if you're going to use a light, there's either the uterine receptivity part. So yes, there is a study where they looked at uterine receptivity using the laser therapy. Now this one was endometrial, meaning it wasn't, they took tissue out and they lasered it at different energy levels and saw how the biomarkers and chemical reactions changed in the uterus, I guess best way to put it. They looked at uterine receptivity. That came out in 2018, and they saw an improvement. So that's not done in human studies for embryo transfers, but they looked at just looking at uterine receptivity, saw a positive change there. As I mentioned, there was one study that's been published on uterine receptivity in an IVF setting. So donor egg, 2 things come up. Could it help with uterine receptivity? So the person receiving it, yes, it could help because it's going to increase blood flow and it's going to help regulate inflammation and oxidative stress. So all that stuff is beneficial for uterine receptivity theoretically. And then if somebody's going to do egg banking and they want to, anybody, if you're trying to improve the egg cells, so whether it's your donor or your egg banking, yes, anything you'd want to do to improve your egg quality, which is a healthy fertility diet. It would be taking supplements to improve your egg quality. It would be reducing stress to improve your egg quality. It'd be going to sleep, all the things that are going to improve the environment to help you reach your peak fertility potential. I didn't say this earlier. This is not a magic bullet. Like people say, oh, I just do laser and I can smoke and I can drink excessively and live in an abusive relationship. I don't see this as a magic bullet. It's like, okay, you're doing acupuncture, you're meditating, you're taking certain supplements. This is another thing to add to the mix, to do whatever you can. As my patients say, I want to leave no stone unturned. And so this is another tool to support your body. It is not a magic bullet. So it's not like you do this and everything's fixed. But when we look at the mechanism, increase blood flow, improve the battery cell, the mitochondria function, regulate inflammation, reduce oxidative stress, soften scar tissue, these are all supportive in helping you reach your peak fertility potential. So can it be beneficial? Yes. Is the evidence there and strong that it's a must do? No, not yet. The evidence isn't there yet. The science is there. And this is what I'm playing with is what's the right protocol and how can we do this? We've seen some interesting things. My mind hasn't been blown yet, but we've changed our protocol just now, early September. But we have seen AMH go up significantly, which is nice.
Okay, hang on, back off, because again, this is lay people. Hang on, Lorne.
Yeah.
AMH, for those of you, hang on.
We've seen certain biomarkers change, good biomarkers.
Okay, okay, great. So, and again, just to put it into lay term, so AMH, it's, when you're looking at your ovarian reserve, so it can help and potentiate that. All right, and then back to Susie for a second here.
But here's how my brain works, Mary. It improved AMH, but we don't know if that improved the ovarian reserve or maybe just AMH went up. We know when people are on birth control pill, it can suppress AMH, and then if they go off it for a couple of months, it goes up. So
that's right.
All I can say is we've seen AMH go up. We haven't done enough auditing and looking. Does that mean also their antral follicle count went up? So I will not say it's improved your ovarian reserve. All I can say is for some of the patients that did the AMH, let us treat them for 3 months and then test it after. Some of these patients we saw an increase in their AMH when they used the same lab. And so
that's a great point. Yeah.
Doesn't mean anything yet.
Well, here's the other thing though. When we're looking at diminished ovarian reserve with these markers, and there's that study where it's talking about you use two groups. They're both same age, and one is in the normal category and one is low parameters. We see that they still both time to pregnancy is the same. So we even though the parameters are low ovarian reserve, it doesn't necessarily mean that you have a diminished ability to get pregnant. What it does tell us is that your ability to use something like IVF and IVF drugs, that may be not as efficient for you, because if you have low antral follicle count, then there's less to work with, right? I mean, that's just more plain and simple. It doesn't mean that you can't get pregnant. And things like acupuncture, laser, and all the other good things as adjuncts, of course, can optimize. But as you say, we can't definitively say that, oh, it's a done deal. We can for sure 100% do this. Nothing is 100%, as we all know.
No, nothing's 100%. And with the
I
AMH, as you said, it doesn't talk about quality. It's talking about quantity. And the latest studies in 2018 that were published is it's more like if you're not doing IVF, how relevant is it? Is a question mark, because you just need one good egg and your reserve is low. But if you're ovulating and you're not doing IVF, maybe it's not so relevant to you.
That's
the
right.
AMH from the IVF clinic perspective is important because now you may not have as many eggs to work with, and IVF is trying to, it's a numbers game. And now with genetic screening, if they get one normal embryo, then you're in, right? Your odds are very high at this point in time, over 70% as we record this. And so It's just for planning. Like somebody says, well, if my AMH is low, what does that mean? I said, well, it means that if you're thinking of doing a doctorate or not trying to conceive for a year or two, you want to rethink that because you don't have the reserve. And IVF is something, if you're thinking about, you may want to think about that sooner than later because it's a numbers game. And not to expect 15 eggs when they do a retrieval, but less. But as you said, and it doesn't mean if you get, somebody else gets 12 embryos and you get 5, you still may get pregnant on that transfer. It's just that they're going to have more. It's not a quality. As of 2018, I say this because they may change. New research may say something. Maybe they say quality and quantity walk together. But right now, the AMH is ovarian reserve indicator, so it's a quantity indicator, not a quality indicator.
That's right. And so, sorry, back to Susie. I don't want to overlook this. Sorry, Susie. But you say that you are doing donor egg implantation. So this completely is in line with what Lorne has been professing now for the past little bit. And because especially if you do have endometriosis, it'll help move that blood flow and it will may decrease inflammation and scar tissue. So it can only help. And I would encourage you to do laser if you have that available where you live. But I also believe that acupuncture is a great thing for that as well. So, or the combination of, right?
Combination. So we do the combination. Like it'd be rare that we wouldn't do the combination unless somebody has an incredible needle phobic. And I mean, like they react. You needle them and they pass out. They get nauseous. As you know, patients come in nervous for acupuncture. And then they let you do 1 or 2 needles and they're like, are they in yet? And then after that, they're fine. Yeah. But there are, I've been in practice since 2000. Myself, I've only had 3 patients that even not putting the needle, we use tubes, right? I remember somebody passed out because I didn't even have the needle on it. It was a plastic tube. But the
right. Absolutely.
So that person is a laser candidate. But if you're afraid, that doesn't mean you're not a candidate for acupuncture. I would say, go in and see how you feel with 1 needle. And if you freak out, then you can just do the laser. I like the combination, as you're saying. But yeah, if you're doing donor egg transfer, then and you're the recipient of these donor embryos, not a donor egg, but a donor embryo transfer, and you're the recipient of these embryos, then for uterine receptivity, that would be something. That's the study that we've sent in for ethics approval, is using a laser on not donors, but on frozen embryo transfers where all the embryos have been genetically screened chromosomally. Right. And so it's similar to the donor. You're assuming it's a healthy embryo. And we know at this point in time with the clinics I work with, they have over a 70% success rate if they have a genetically normal, a chromosomally normal embryo. And so what about the other 20 to 30%? And so can the laser, can the acupuncture improve that? And that's what we're hoping to do the study on. Our small little audit for the last 2 years showed a good trend and showed significant improvement when we did treatment for 7 or more treatments before the transfer plus the transfer.
Right.
That's where we saw the best. And then on transfer day, we saw a trend towards higher pregnancy rate, lowest miscarriage rate. So another take-home message is, if you're just doing transfer day treatment, I don't know if that's enough. I think the dosage is important, having a series of treatments before. Agreed. And I explain this like, if you wanted to get an A+ when you're in school, you don't just study the night before the test. You're studying for several weeks, a couple of times a week, prepare for that test. If you're training for a race or a marathon, you don't just train the day before the marathon. You train for several months before. That's the way acupuncture works. It's not a drug like a magic bullet. It does require dosaging. So a period of several weeks is where you're going to get the most benefit. And Lee Hollander-Rubin's study showed this. The Magarelli-Credenda study showed that you need, Magarelli-Credenda study showed 9 treatments before transfer was key. Lee Hollander-Rubin showed 12, right?
And then so he did 9 plus the pre and post. So then that became 11.
Yeah, 9 before transfer, and then 12 before transfer plus the transfer.
And then so I want to add to that, Paul Magarelli, he won't actually do a frozen embryo transfer unless you actually do the acupuncture. So I thought that was interesting.
I
So you
know
have
that.
to do that. Yeah. So that, and CCRM. So that's the
Years ago in Colorado, CCRM. What they
yeah.
were doing back then, I didn't know it was everybody had to do it, but back then they do the color Doppler ultrasound to see blood
Yes.
flow. And
Yes.
if you had a poor blood flow, then they recommended you to do acupuncture for several weeks before you did your IVF and transfer. That's how that was how they did it. If you had poor blood flow, you were recommended to acupuncture.
Except now they're just as a standard protocol for frozen embryo transfers. So they just tell the patients to do, 8
Fantastic.
sessions plus. Yeah.
Yeah, I
So
think it's
that's great.
it's a great. I mean, we're seeing in our practice, so we do the acupuncture and we use laser and acupuncture on transfer day, and we do definitely acupuncture leading up to the transfer, depending on the patient. Sometimes laser for frozen. The frozen
Yes.
study that we propose is only laser, so we're going to try. The study is just using the laser to see what we can do. So
Cool.
that's what that proposal
Fun.
is. It'll take a while before we can recruit and do that, but that went in, and then the next study that we want to do a multi-center study, and there's 4 clinics, 2 in the States, 2 in Canada that are interested. That would be for fresh cycles, but they would be all genetically screened. But
Right.
we would have that preconception time to see, are we changing embryo quality? And we'll do this by looking at, do we get more euploidy embryos, more normal, chromosomally normal embryos?
Which is very cool study. So thank you for doing this. I think I would love to hear more about that later. I just want to address one more thing. You mentioned, we're talking about the ability to have a healthy pregnancy is 70% with a chromosomally normal tested embryo. Now, the other piece to this, it's not just
70% implantation.
implantation. Excuse me. Yes.
70% implantation.
So but the point is, one of the takeaway that I want women to get is that it's not 100%, and that sometimes, yes, we can help to increase it with your uterine receptivity, but sometimes even a normal embryo is actually not a baby.
100%. I started in 2000, and back then the success rate for IVF was around 25%. Now it's over 50% in general at the clinics I work with at Olive. And then when you get when you do the chromosomal screening, it's like 75% plus. It's still not 100%.
Exactly.
The technology has improved. I mean, in the last 8, this is 2018 we're recording this, so in 18 years, can you imagine from 25% to 75%? The technology has really changed, and more and more transfers are frozen now because of vitrification. They can freeze and thaw much better, the technology. So the technology has improved a lot. And then you add things like mind-body stuff, hypnosis, acupuncture, certain supplements, laser therapy. I mean, there's certain supplements I love for the whole egg quality idea. There's so much that the couple, the man and the woman in particular, because no matter what, she's involved, right? No matter what, there's always a woman involved to receive the embryo and carry it for pregnancy. There's just a lot of things that you can do to take back control of your fertility through diet, through lifestyle, through like free things. And then there's things you got to pay for, the acupuncture, the laser therapy or IVF, but just diet therapy, sleep, exercise, meditation. There's a lot of things that you can do that will work in your favor to support you on your peak fertility potential. Because our goal in Chinese medicine is a healthy baby, right?
Yes.
And so all the stuff you're doing 3 months before you conceive or 3 months before you do IVF is setting the health blueprint. We call it epigenetics, the health blueprint of your future child. And that's what Chinese medicine was all about. They didn't have a fertility problem. They just wanted healthy emperors. They wanted a healthy baby. And so it was all about how do we improve the future health of the next generations. And that's where the preconception comes in with Chinese medicine, which we call nourish the soil before you plant the seed.
All right. So this comes to, because we're talking about diet, and I know you have a book, a copy, so you can get a copy of the AcuBalance Fertility Diet. So do they go to your website? So your website is acubalance.ca.
Yeah, with
Oh,
one
and
C,
it's a free.
acumouse.ca,
Okay.
it's on the it's for free, so you can download the fertility. Talks about the fertility diet, and it
Yeah.
talks about and it has some recipes that you can download.
Awesome. So thank you for that. Thank you for the interview, which was only supposed to be 20 minutes. And now we are at 9:20, everyone. I apologize. And some of you are still here. So that is awesome. Thank you for joining us and staying with us. Hopefully not falling asleep. And please join me next week. And we're going to have lots of fun as always. So thank you for joining me. If you haven't picked up my book, check it out, Pathways to Pregnancy. And also on October 7th, I believe, it's a Sunday, I will be doing my fertility circle. So join me with that, because we're going to talk about courage, because you need a hell of a lot of courage to endure this journey, I tell you. And we'll go through a lot, and we'll coach you, train you. It'll be awesome. So thank you for joining us. Have a great night. Thank you, Dr. Lorne Brown. Thank you for sharing, and keep up the great work. I'd love to hear more about the studies that you're doing. So that's it. Have a great night, everyone. Take care. Bye for now.
Thanks, Mary.
You're welcome.